Healthier cattle and healthier profits. It's what lot feeders around Australia are working to achieve. And controlling bovine respiratory disease, commonly known as BRD, is one of the most important things you can do to reach your goals of improved herd health and increased profits. BRD is recognised as the single most costly disease affecting cattle finished in feedlots. That's why increasing and maintaining herd health is so vitally important, especially with the increased demand for Australian beef and the expansion of the feedlot industry. 2 years ago, Intervet Australia launched Bovilis MH, now an integral tool in the disease management protocol of many feedlots throughout the country. Troy Setter is the manager of Killara Feedlot. He's been using Bovilis for some time and shares his experiences so others can benefit. Well, Troy, what are the major health challenges that you face here at Killara Feedlot?
The major health challenge for us at Killara is bovine respiratory disease. It causes the vast majority of our sickness and our potential loss of production.
So what have you been able to do to try and reduce the impact then of the disease?
Certainly for us, the best way to control BRD is to be proactive and certainly work up front prior to the cattle coming into the feedlot's a great start. So we're looking for the right cattle from good producers. We're really looking for yard weaned cattle and cattle that have got a total package of respiratory disease control measures, and the respiratory disease vaccines are certainly part of that program. Once the cattle arrive at the feedlot, we get them inducted as quick as we can into the feedlot. We use respiratory vaccines including Bovilis. We then move those animals onto feed and water as quick as we can, and try and keep them in their lot groups that they're purchased in, and control their performance from there.
What is the most important thing that producers can do to really prepare their cattle well for entry into a feedlot?
Certainly the pre-vaccination is very important. Coming into the feedlot, our results have shown some really positive results of cattle that have been pre-treated. Well-managed cattle coming onto feed that have been on a rising plane in nutrition and certainly have been handled, yard weaned, been ran as a mob together for a couple of months really makes a big difference to us in terms of performance.
Of course, it's now understood that BRD is a complex disease that involves many contributing factors like stress, mixing and infection to compromise lung defences. Tony Batterham of Quirindi Vet Clinic sees the effects of the disease firsthand and recommends several strategies to help combat it. So Tony, in your opinion, what are the key risk factors that make an animal more likely to develop BRD in those first 3 weeks on feed?
Well, essentially, if we place younger, lighter weight cattle that come from multiple sources of origin, and those cattle have had significant periods off time and feed, and one of those scenarios is through sale yard systems, those cattle will be at a higher risk of BRD their first 3 weeks on feed on the feedlot.
Well, what about stress and things like that? There must be other issues.
Sure. Now, there's a lot of stress. There's a lot of stress points in that journey from paddock to feedlot. If those transits are particularly long, with 16, 18 hours on a truck, that is a significant stress factor. All that time's been off feed and water as well, and those cattle have had to compete on the truck and mix with strange cattle. Stress, if it's in large enough amounts, and if all those stress points are additive, that's a significant stress to the cattle's immune system, and yeah, their immune systems are lowered, so they're at risk of disease. The disease isn't actually caused by any new pathogens. These pathogens are unique to cattle. They are the normal pathogens in their respiratory tracts. Those stress points just lower their immune system and allow those normal pathogens to multiply and gain access to the lower respiratory tract, and hence BRD. Health management in a BRD sense can start all the way back to on the producer's farm. It's as simple as yard weaning. We discovered in the 90s that yard weaning cattle, as opposed to paddock weaning, gave those calves a significant benefit when they were placed on the feedlot. There are low stress stock handling techniques are getting a lot of press lately, and there are some good principles there that we can apply to cattle so that their adaptation to the feedlot is seamless and easy. Producers can also, especially backgrounders, can put together homogenous groups of cattle. So these are cattle of the same frame size, the same even lines. Those cattle are going to compete on an equal basis when they get to the feed yard. But a very useful tool in backgrounding and for producers on farms for direct entry is pre-boosting with respiratory vaccines. And removing internal parasites and sort of not letting any cattle go to the feedlot that have got pre-existing disease. But pre-boosting is a very useful management tool. The ideal feeder steer, if you could follow a couple of principles, then I think we'd have a healthy steer every time. If we can paddock source those cattle, if we've got a good relationship with that producer, then we're well on the way. If those cattle have been yard weaned, if they've been yard weaned for up to a week, and in that period they've had some social conditioning, they know and they're happy with the exposure to people, machines, they actually learn how to form social groups in that yard weaning setting, and those cattle are weaned at a relatively early age, and they get over a lot of the stresses in life, such as castration and marking and those other procedures relatively early. And then those cattle are in good forward condition when they hit the feedlot. Bunk training is very useful. If you can get those cattle used to the feedlot environment in a low stress setting, then that's great. The ideal feedlot bovine would be, he would have many of his friends and pen mates that are exactly the same size and exactly the same competitive potential. That we've removed all parasites and all pre-existing disease from those cattle before they get to the feedlot. If they're heifers, they're not pregnant. That we've got good data management. All of those cattle are at least NLIS tagged, but we've got good traceability on them. You know, certainly if their rumens are full of feed, they're well hydrated. But I think certainly key to the ideal feedlot bovine would be a pre-boosted, pre-vaccinated steer with the many good products that we already have.
Striving for even better outcomes is something Intervet Australia takes very seriously. Kev Sullivan, consulting veterinarian at Bell Vet Services, has done extensive trials of pre-vaccination with Bovilis MH versus vaccination at induction only. And I've asked him to share these findings with us.
Kate, over the last 12 months we've done 2 extensive trials. One where we vaccinated every alternate group of cattle at arrival at the feedlot for a 12-month period. And the second trial where we got producers to pre-vaccinate the cattle prior to arrival. And then we gave them their second dose once they arrived at the feedlot. The idea of this was to examine what the difference between these 2 vaccination regimes might be. In the first instance where we vaccinated at arrival, what we discovered from that was that we had a reduction in the mortality of, in that particular study, 15%, but in other studies I've done, we've had a reduction of between 5 and 25%. So this 15% mortality reduction occurred over a 12-month period. However, if we looked at the death loss of the cattle which entered the feedlot in the risk period, during the spring and the early winter, we found that in vaccinating the cattle at arrival reduced the mortality by 30% in that instance. The difference in morbidity, though, wasn't as dramatic. In fact, there's no difference in the number of cattle that were pulled sick from the feedlot in either group, either the vaccinated or the unvaccinated group during this study. There was a slight difference of about 5% in the cattle during the risk period. So to sum it up, with that particular study at vaccinating at arrival, yes, we do get a reduction in mortality if the cattle are vaccinated with Bovilis MH at arrival, but the benefits are bigger at the risk period of the year. The studies we've done with pre-vaccination, we asked producers to pre-vaccinate the cattle at least 2 weeks before they came into the feedlot, and then we would give them the second dose when they arrived at the feed yard. Some of the producers vaccinated at 2 weeks and others vaccinated out at 4 weeks or even 6 weeks before they arrived at the feed yard. And then they got their second dose at arrival, of course. We found a dramatic reduction in the mortality, in the deaths in this group, where the death loss was reduced by 80% in some groups, and in other groups as low as much as 60%. In this particular instance, though, the number of cattle that got sick also reduced a lot, and we had a 50% reduction in the number of sick cattle where the cattle had been pre-vaccinated prior to arrival at the feed yard. So this was quite a remarkable turnaround in the health of these groups of cattle.
So, Kev, based on the trials that you've done then, what are the key recommendations that you can offer to producers or backgrounders?
We've got 2 issues here, Kate. We have a producer who breeds his own cattle, sending to the feed yard. That person needs to pre-vaccinate at least 2 weeks prior to entry to the feed yard, and then the feed yard will give the second shot. Backgrounding is a little different situation. In the backgrounding situation, where the cattle are purchased from a sale yard and then background on the property, those cattle need to spend at least 4 weeks on their property before they go into the feed yard. So the program would be, you buy the cattle from the sale yard, bring them home, give them their first shot of Bovilis, put them in the paddock for 4 to 6 weeks, then take them to the feed yard. They get their second shot at the feed yard, and we then get results very similar to the program that the breeder would run. The Bovilis vaccination program is one tool in a whole suite of things that can be done to improve animal health in the feed yard. Most of this happens back on the farm or back in the backgrounding situations. The important keys are, one, if you're a breeder, is to yard wean your cattle. Yard weaning has shown to have a huge impact on the health of those cattle once they arrive at the feed yard. Other things that are important also include bunk training, so the cattle know how to eat, but also things like professional cattle handling, where you actually encourage these cattle to behave in a manner and lose their fear of humans. Fear of humans is one of the biggest stress that cattle encounter. So these plus the vaccines, including the IBR vaccines, are all important tools when it comes to managing the health of the cattle at the feed yard.
Kev, based on your trials, what then are the key recommendations to feedlot managers?
To feedlot managers, I would recommend that firstly they try and source cattle directly from producers, working with those producers to ensure the cattle are pre-vaccinated with Bovilis MH at least 2 weeks prior to entering the feedlot. Secondly, for those producers, those feed yard managers who are buying backgrounded cattle, I would suggest they work with those backgrounders to ensure that the cattle spend 4 to 6 weeks in the paddock prior to coming to the feed yard, and that they are pre-vaccinated with Bovilis at the start of the backgrounding period. And thirdly, and the last option, is if they have to get cattle directly from the sale yard, that they still give them a shot of Bovilis MH at arrival, because you will get a reduction in death loss in the order of 5 to 25%.
The benefits to the industry are many and varied, and well-known industry leader Sandy McConaughey believes it is the way of the future. Sandy, can we start first with an overview of where you believe the Australian feedlot industry is at the moment?
The Australian feedlot industry is in a very healthy state at the moment, and it has been now for a number of years. It's been progressively growing at about sort of 10% per year for about the last 10 or 15 years, but it's actually the last 2 years it's almost doubled that growth. But I think it was a natural progression anyway. It's been happening. It sort of happened other parts of the world, particularly the USA, etc., where we've still got some ways to go and to get their sort of category, but we've got about, over 1 million cattle on feed at the moment in Australia.
And then what are the major benefits for producers in preparing better cattle?
Preparedness of cattle is extremely important, and the healthier their cattle are when they enter the feedlot, the better they perform within the feedlot, and etc. So obviously the guy running the feedlot is going to be a lot happier. Suppliers, cattle producers, whether they're professional backgrounders or breeders, etc., the better that they can prepare them to go to the feedlot, the better off they're going to be as well, because there definitely will be passed back down the line and in higher prices, call it premium if you like, but it'll definitely benefit the industry.
Just Sandy, briefly, would you be able to list what you see as the major benefits for having well-prepared, healthy cattle in the feedlots for the industry overall?
Major benefit, industry overall, is cattle are better prepared, cattle, a lot more immunisation going on. That's going to give the protection to the cattle. They enter the feedlot, they're going to perform better, they're going to be requiring a lot less in the antibiotic usage, etc. And I say etc., I can't stress that enough. So, and there's that word stress. You reduce stress, you improve the performance of cattle, they arrive better, they do better in the feedlot. They do better in the feedlot, they do better down the line, down the chain, and by the time they get through to the customer, it's a much better product with a better image.
Bovilis MH has proven itself in the field and is now widely used. And as we've heard, it's got both industry and grower support because of the results achieved. Veterinarians and producers now know that end results are greatly enhanced with a 2-shot regime, one at backgrounding and one at induction. And now Bovilis MH is also available in a 100ml pack, as well as the original 250ml pack, to better suit the backgrounding market and offer more flexibility and choice for producers. What's more, Bovilis MH is manufactured right here in Australia using antigens derived from Australian field isolates to better suit Australian conditions, Australian cattle and Australian producers. With runs already on the board, Bovilis MH is poised to make even more of an impact on the industry. So if you're not already using Bovilis MH, now's the time, both for healthier cattle and healthier profits.